Just to check and make sure that you're in the session that you have chosen, this is a session that is focusing on water and public health. Coincidentally, this is the week during which the American Public Health Association is meeting, but they're in Denver and we're here. So we are very happy to welcome you to this event. As you know, Catholic Relief Services and Villanova have a formal contractual relationship, and in many ways we share the same values and the same objectives. And today we're focusing on water, and we have two panelists and a responder who are well qualified to speak on the topic. Let me introduce them. Each will speak for approximately 20 minutes, and then we will ask the responder to speak for a little bit a briefer period, and then you'll have an opportunity to ask questions, make comments, etc. Let me first introduce the first speaker, and she's on my immediate left. Dr. Fran Keene is somebody I know very well because we work together. She is an associate professor and the assistant dean for undergraduate education in the College of Nursing here at Villanova. By the way, I'm Louise Fitzpatrick, the dean of the college. I neglected to tell you who I was. Fran is a person who received her basic education at Johns Hopkins in nursing, her master's from the University of Maryland, and her PhD from Catholic University of America. She has had a lot of interesting international experiences during her professional career. She's worked for the Pan American Health Organization and Project Hope in the Caribbean and Latin America. She was a Fulbright scholar in Malawi, Africa. And here at Villanova, in addition to her administrative responsibilities, she takes our students to Durban, South Africa, where many of you know the Augustinians have a mission, and our students in the College of Nursing return there every year with our faculty. The second speaker is a Villanova original. That's Bridget Wazik, and Bridget is a graduate of Villanova. Her bachelor's is from Villanova, and her master's and PhD in engineering from UT Austin. And we are very delighted to have her with us. She holds her PhD in civil engineering, and her interests are stormwater control measures such as wetlands, rain gardens, green roofs, and infiltration trenches, and a whole lot of other things that I don't understand, Bridget, but I know you're going to help us understand them. Welcome. And the responder is Mary Hennigan. Mary graduated from Tulane. She has a master's in public health from Tulane University School of Public Health and Tropical Medicine. She has worked for a variety of private voluntary organizations, health and nutrition organizations, and has been involved in those kinds of activities for a long time. But since 2003, she's been a senior technical advisor in health and nutrition for Catholic Relief Services. So she is a member of their staff. Her interests include prevention of early childhood malnutrition, malaria, and the integration of nutrition in childhood and among other populations. She's collaborated on various publications and tools in nutrition with FONTA 2, which is a U.S. government project that provides technical assistance for food and nutrition programs, and CORE, C-O-R-E, a network of 55 U.S.-based nonprofits working in the international community, involved in community health and community-based health programming. And she also serves on the board of CORE. So we welcome our speakers and our respondent, and we'll begin with Dr. Keene. Let me get out of everybody's way here. There are a lot of cables, and so we're being very careful not to have any mishaps here.
Thank you, Dean Fitzpatrick. And we have a slight technological glitch up here in that I can't see on the screen of the computer what you're seeing up there, but I'm going to try to get my mouse to make this a slideshow, but I can't even get a mouse to visualize up there. You have any ideas, Bridget? engineers, I figure maybe. If not,
No pressure.
as a result of working in a variety of countries around the world, I can go with technology or without any at all. So, if I have to, thank you. Okay. My approach to this is quite different, or somewhat different, from what you've heard already today, in that I want to bring home to you how important water is, why we need it, what happens when we don't have it, what happens when we don't have clean water, and therefore, as a result of all that, then that leads to conflict. I'm not really going to address the conflict aspects of it per se, but try to help you see how important it is and why it is such a possible issue for conflict. First of all, we all need water. And when I was preparing this, I didn't stop to think about the animals. The animals are in competition for this same water that the humans are in competition for in areas where the water is scarce. And that also can lead to possibilities for contamination, because the animals that are drinking the water may also be using the water for other purposes. But as you can see, we all need water. Americans, unlike much of the rest of the world, we have plenty of water, and we use on average 100 gallons of water per day, and that's at home. That does not include the car wash, which I shouldn't have put in here. That is strictly water use at home. So obviously it's a tremendous amount of water that we use. By comparison, the world's poorest live on fewer than 5 gallons per day. And international guidelines suggest that the total basic water needs for drinking, cooking, and personal hygiene is at least 15 liters, and that's approximately 4 gallons per person per day. So therefore, we have a lot of people who are living at that level or less. Now, obviously, there are variations in how much water people need based upon where they live, the climate, certainly also what types of sanitation facilities they have available, what their diets might be like, whether or not they have any religious or cultural practices that use water. Certainly, their own personal habits, the clothes that they wear, that type of thing can all affect water consumption. We do know that water consumption goes up the closer you live to a source of water. So if we increase water, which obviously is an aim of many, many NGOs, is to bring water in, but we know that as we bring water closer to someone's house, the use also goes up. Almost 1 billion people on the planet don't have access to clean, safe drinking water. This statistic varies somewhat. I took the lower side, almost 1 billion. I've seen it as high as 1 to 2 billion. So obviously there are a lot of people who do not have access to clean drinking water. This picture certainly demonstrates someone who doesn't have clean water. And unsafe water and sanitation causes 80% of all sickness and disease and kills more people than all different types of violence, including war. And this was mentioned earlier today. When contaminated water is all they have, then it has to be used, because we have to have water. The minimum amount of water that people need for drinking purposes is about 3 liters or 3 quarts per day. And again, that's going to vary somewhat depending upon where you live and what the climate is like. Now, I'd like to tell you a little story about Ulefta, who lives in Ethiopia. And this is a quote from her to give you an idea of what it means to her to try to get water for herself and for her family. She lives in Ethiopia, and the local water source for her, it's not really that local, but because she has to walk to it, but the water source is a small river or creek. I have to collect my water from here every day. It is very difficult to drink this water. It feels very uncomfortable and gassy in my stomach. Most people here are sick from stomach diseases from drinking this. When the children get sick, we use traditional medicine. Now, by traditional medicine, she means non-Western medicine. Sometimes it works and sometimes it doesn't. When it doesn't, we take them to the clinic, but the nearest clinic is about 2 hours from here. Even after taking them to the clinic, most of the children die. Children often die here from the water. Often all of the money we earn from farming is spent on medicine. Okay, some other additional statistics and information on dirty water and what it means to people is, first of all, the consumption of the contaminated water. Statistics and studies that have been done suggest that if people can get clean water, the death rate can be reduced by as much as 21%. And then the other part of that is if you have clean water available that one can wash their hands on a regular basis, that alone reduces deaths by 45%. And both of these, they seem very simple to us, but they're really huge measures and make huge differences in people's lives. And for us, it's hard to fathom that if the only source of water we have is contaminated, that we would go ahead and use it anyway. But think about if you're walking for hours for your water. And when that is the case, it's very difficult to persuade people to use water for anything other than their drinking use. I mean, that would be obviously the minimum, the absolute that you have to get is those 3 liters for drinking. Then beyond that, everything is sort of a plus. And so certainly when people have been interviewed and talked to about this, it's not uncommon to have people say, well, I can only wash my hands once a day, my body occasionally, and I wash clothes once a year, because the water just simply isn't available. And I quote, this is another woman who said, "We don't have enough water for drinking. How can we wash our clothes?" Okay, now of course, since I'm in nursing, I thought I would give you a little bit more information about disease. And so you really know what this means, other than just saying water is contaminated and people get sick from it. There are lots of diseases, and I only listed a few. There are lots of diseases out there that are waterborne, which means that the water itself carries the organism or the parasite and causes the problem, or it's water related. And like I said, this is only a very small part of this list. Okay, first of all, with waterborne, starting with the very simplest, diarrhea. We might in this country say we have gastroenteritis. In other words, we're kind of nauseous, vomiting perhaps, and we also have diarrhea. That accounts for 1.8 million deaths on an annual basis, and that's 4% of all deaths. And as mentioned earlier today, a large majority of those deaths are with children. The reason being is that children are more vulnerable. First of all, their immune systems are not as highly developed, but another very important fact is that their bodies are composed of more water than an adult body is. And so therefore, their response to dehydration is going to be much more severe, and they're going to die more quickly because of that higher percentage of body weight being water. Going down the list, hepatitis A, cholera, and typhoid are all fecal oral diseases. Now, for those of you who aren't in nursing who don't know what that means, it's not real pleasant. Fecal is stool, bowel movements. It means it's in the water, and that those organisms that are carried in the feces have to get from the water into your mouth. And that might be as a result direct contamination of the water that the person's drinking, or it may also be, which is common, that water's been used to either water agriculture, or that water's been used to rinse vegetables and fruits, or the person actually handling the food sheds those organisms in their own bowel movements and are not adequately washing their hands afterwards and then handle your food. That's probably what happens most commonly here in the U.S. when you occasionally hear about an outbreak of hepatitis A on a cruise ship or in a fast food restaurant. That's because the person handling the food is shedding the organism in their stools. But in other cases, it's because it's actually entered the water supply, or that water's been used to rinse the vegetables and so forth. And this is why when you travel internationally, there's a very famous quote that goes, "Boil it, cook it, peel it, or forget it." And so that's when you're eating vegetables and fruits outside, in a traveling kind of situation. Now, All of those, hepatitis, cholera, and typhoid, they're all fecal oral. And I just wanted to mention about the cholera. We've most recently heard about the cholera epidemic in Haiti, but there's been an ongoing epidemic of actually a much greater size in Nigeria since the beginning of this year. What's unique about Haiti's is that cholera had been eradicated in that country and had not shown up for several decades. And now it has reemerged. Exactly why, people aren't sure. I mean, all you really need is one carrier bringing it into the country. So, and then with the poor water supply now and the sanitation issues, plus if you have heavy rains or hurricanes, whenever you have a situation where flooding occurs, that also increases the likelihood of cholera because that contaminated water spreads over a greater surface area. By contrast, Schistosomiasis is a parasite, and it's a parasite that likes to live in freshwater snails. And so the children, if they go into rivers or bodies of water that have these snails, the parasites then burrow into their skin, and then they carry the parasite for years and years. And it can be very mild in terms of symptoms, or it can eventually get to the point where they suffer liver damage and renal failure. So that is also a serious disease, more so than simply some diarrhea or intestinal problems. Now, in terms of water-related, both malaria and dengue fever rely on the mosquito. And in order for mosquitoes to breed, they have to have bodies of water, and preferably stagnant water. It could be something as small as a container that hasn't been emptied in the backyard, or it could be a stream that lowers during the dry season. The eggs are laid on the bank of the stream or the river, and then when the rains come and the river rises, then those eggs now have water and hatch, and you have mosquitoes again. And that's why malaria, for example, is much more prevalent during a rainy season in a country. I think that's it on the on the attractive aspects of this, but you can see that obviously water, contamination of water, the diseases that it causes or contributes to is huge, and that's why clean water supply is so important to people. In addition, some statistics that relate to waterborne and water-related diseases. Childhood mortality is certainly one that's very severely affected. And in many countries around the world, 1 in 5 children, or 20%, die before their 5th birthday. Childhood is considered 5th birthday and less in terms of childhood mortality. Life expectancy in many of the countries that don't have adequate water supplies or clean water, you're talking about life expectancies in the 30s and 40s. Certainly water is not the only thing contributing to this. We know there are other diseases out there, certainly the HIV/AIDS epidemic, motor vehicle accidents, other things contribute to this, but water and contaminated water is a huge part of this. Also, there are studies that look at what these diseases do in terms of a country: days lost from work, people not being able to go to school, decreased productivity, lots of other things that can happen. 46% of people do not have water piped into their homes. That means they have got to travel to get that water. And women, and this is the tie-in with gender and women, women are the carriers of water. They are the beasts of burden in vast number of countries in the majority of the world. And they walk an average of 3.7 miles to get that water, and that is on a daily basis. And I just put in a few pictures. You can see that in a variety of countries what's happening. Jerry cans were originally made to carry gasoline on the sides of Jeeps, but they're commonly used to transport water. And when they're full, they weigh as much as 40 to 50 pounds, and women and children carry these. I've been told I'm running out of time, so let me see. I think I will do this one video clip if I can get it, but I don't know if I can get it to work. There it is. Maybe I'll I'll have trouble with it. Maybe I should go on. Uh-oh, where's the volume?
Five dies before their fifth birthday. Millions more children suffer from waterborne diseases like typhoid and diarrhea.
2.5 billion obviously don't have access to basic sanitation services and hygiene diseases, and water alone will not work, which affect having access to children throughout basic sanitary facilities.
For many, the dangers lie in collecting water, a job often handed out to girls and women. Instead of attending school, a child may have to walk several hours a day to the nearest water source. Children's health improves and school attendance rises. For many, the dangers lie in collecting water, a job often handed out to girls, sanitation and hygiene education. Instead of attending a child on reducing walks several hours a day to the nearest water source. UNICEF works around the globe installing improves and school attendance rises when water pumps are installed in schools. Basic sanitation and hygiene education has a dramatic effect on reducing mortality and poverty. UNICEF works around the globe installing latrines and pumps. But 1.1 billion people still use unclean water. UNICEF warns the international community must increase efforts or the poorest families will continue to suffer. Access to just 20 litres of safe water a day for everyone means 1.6 million more children stay alive each year. This is Rachel Bonham-Carter reporting for UNICEF. For every child, advance humanity.
Okay, and then I'll bring this to a close here. Also related to water is certainly the role that water can play in a food supply, helping people become self-sufficient by having a garden, watering their garden. And we also heard today about the Millennium Development Goals, and one of the development goals relates directly to water. And the goal for that is to halve by 2010 the proportion of people without sustainable access to safe drinking water. In some countries, that goal is actually well on its way, and in some regions of the world. In sub-Saharan Africa, it is not. That is still not to the point where people would like to have it. And then I also have just included very briefly those methods that a person might use to clean water on a household basis. This is not large supply. This would only maybe get you your 3 liters that you need for drinking per day. And SODIS is a method that's been developed using soda bottles, filling them with water, and then laying them out in the sun for a minimum of 6 hours. And I just ended here with some children who obviously have gained clean water. And I will end this with a very short, brief story. Your village gets a well. The walk for water that used to take everyone 3 hours now takes 15 minutes, and the water is safe to drink. A community worker teaches your village the importance of sanitation. Your community builds latrines and sets up hand washing stations. You join the water committee to oversee the village's new water source. As a woman, this is your first local leadership position. You use the extra time and new water source to start a vegetable garden and feed your family. You sell your extra food at the market. Your children spend more time in school instead of walking for water. They graduate and go on to become a community worker, a teacher, or a local small business owner. Thank you.
Thank you, Fran. As always, there's some technological issues, but hopefully we're over them. And I would like to now introduce Bridget, who will give us a perspective as an engineer.
Okay. Excuse me, I have a little bit of a cold, so don't worry about my scratchy voice here. So again, I'm going to be talking a bit about the engineering perspective in terms of water, public health, and conflict. I'm going to talk about some of the observations that I've seen. I'm also the advisor for Engineers Without Borders here at Villanova, and we've taken several trips to different countries around the world and worked with them in trying to develop different types of water systems and whatnot. So as an engineer, our favorite question is, what is the problem? And our second favorite question is, how do we then solve that problem? That's what engineers like to do. We like to solve problems. So the problems that we're working about today in general, if you were at the earlier sessions or if you're going to be at the later sessions, is access to water. And how do we solve? So that's our problem. How do we solve that? An engineer is going to want to say, build a conveyance system, build a pipe system, build some sort of storage tank, build a filtration system, or whatever the case might be, to help provide a community with a reliable source of clean drinking water. As we just heard, clean drinking water is very important for public health and whatnot. Diarrhea, again, one of the leading issues, and that's one of those vicious circle type diseases. I believe it's it's the fourth leading cause of death in developing countries. And so you are going to get a diarrhea-related disease because you drank dirty water, it dehydrates you, you want to drink more of that dirty water, and the cycle continues. And so you really can't get out of that. Where you start to have issues where lack of water access is starting to affect public health, then you're going to end up with conflict issues. Those conflict issues, maybe it be at the state level, maybe it be at the local level. When we're talking about conflict and water-related issues in a developed country like the United States, there's often measures for conflict mitigation. So there's through law and through rules, we have ways to deal with that. Those are less developed in developing countries, and that's what we're going to be talking about today. So how access to water is crucial to public health, and then how this lack of access might cause conflict. Again, developed countries are not immune to this, they just have those measures to sort of help. And I'm not going to have a very technical talk, it's more just going to be two anecdotal stories of where the students and I that went there observed some conflict in dealing with what we were thinking that was originally just a technical issue, but ended up being confounded by other issues, more cultural issues or political issues. So the first story is going to come from Kenya, where we're working with the Maasai, and then I'll move to Thailand, where we're working with the Lahu. So the Maasai, you might have heard of them before. They're a tribal community. They're in Kenya and Tanzania. We were working with them in Kenya. They are a very traditional group in terms of their culture, in terms of the way they live. They're a very community-oriented group. They have a very rigid structure, tribal structure. You have your elders and your warriors, and then your children and your women. Some of their culture and their understanding and way about life is starting to weaken because of Western influence and because of lack of political voice, which I'll get into a little bit. But again, they're also a very happy people. Actually, one of our students who was on both trips with me, Rory, is right up here. So if I miss anything or say anything wrong, just let me know. But he can attest to every morning you would wake up and everyone asked you if you had good sleep, and you asked them how they were, and you heard Hakuna Matata, no worries. So despite all their issues, incredible poverty, I can't even explain the amount of poverty, they're still very happy. And they dealt with the conflict of not having water quite well, considering. So where they're located in Kenya, I don't have a pointer, but they are in Amboseli National Park, which is right there, just at the foothills of Mount Kilimanjaro. Mount Kilimanjaro is sort of the white spot. So it's on the southern border of Kenya and Tanzania. And Amboseli National Park, and there's several other national parks within Kenya, and they were set up in the 60s, 70s under the pretext that they wanted to have a wildlife preserve, but there was also a strong push for tourism. So they wanted this to be a place where you could have people from the West, from the United States, from the UK, from Australia, to come for safari. Where Amboseli National Park was set up this was a savanna land. There was plenty of ground for their crops, or their cattle, rather, for grazing. They were close to water access. So in 1974, Kenya and Kenya Wildlife Services basically kicked the Maasai out. One thing I didn't mention earlier is that the Maasai are traditionally a nomadic people, but again, over time, they have become more settled again with Western influence. And so even if they might move around, they're still moving around within this part. And so they got kicked out of this area where they were close to a water source. There were two major promises made to them. The details of the promises are fuzzy at best. I don't know if there's any real documentation. I'm sure there is. No one seems to have access to it. When you talk to Kenya Wildlife Services, there's one story. When you talk to the Maasai, there's another story. The two promises are, one was monetary and one was water. The monetary promise was that they would get a portion of the proceeds from the entrance fees into the park. Some say that there was also supposed to be a proceed or a portion of the proceeds from the lodges within the park itself. And the other promise was, because they were moving the Maasai outside of the area where they had settled, they were going to allow them to enter the park freely to get water, and they were also going to build and maintain a pipeline, or this is at least the Maasai's perspective. They had built a pipeline and a pumping station, but it was not maintained well. So yes, it was done in 1974, but it sounded like from the mid-'80s onwards, the relationship with KWS, Kenya Wildlife Services, was really non-existent. They weren't getting their money, and they weren't really getting water. So you can see the seeds of conflict. So what's the problem? This is a picture of where Amboseli National Park is. In the background, you see Mount Kilimanjaro there. Actually, a few of my aunts went on safari here less than a decade ago, and this is exactly what it looked like. However, that was before the drought. There have been a severe drought over the past several years, particularly bad from 2007 to 2009. It's getting slightly better right now, but it really hasn't picked up. This is what it looks like now. Very little grass, very little greenery around. You can see there's a herd of elephants and the dust that they're kicking up. Not only is there a drought, but there's now elephant overpopulation, and elephants are really, really destructive over any of the water sources that they were trying to develop, whether they'd been natural sources or the sources that they had built, if they had made a well or something like that. So they were in this situation where they had no green, and cattle is a major, basically it's their money. And I'll talk about that in a few minutes. So there's no place for their cattle to graze or get water, nor any place for them themselves to get water. So any crops that they did have were gone. Again, animals were dying because of lack of grass for them to graze on, because of lack of water for them to be drinking. So competition was quite fierce for the few water sources there were. And as Dr. Keene pointed out earlier, it's not just us, people, humans who need water, but also the animals, which of course, being next to a wildlife preserve is a huge part of that. So it's people versus wildlife for the water, and also even people themselves. Children were often shouldered out of the way to get water for the livestock. Again, the Maasai, very traditional people, don't really work in cash, they work in cattle. So their currency is cattle. And just imagine if your dollar bill started shrinking and you weren't able to use that. It no longer had a value of a dollar bill. That's essentially what was happening to their dollar bills. So lower members of society, children and women, were getting kind of shouldered out of the way so they could get water for their livestock. So where they got water, there were a few communities around that had been able to bore well holes. So there were some taps. That was a hand pump, though. You're not going to be able to really feed cattle water out of there. On the upper right-hand corner are some pictures of the cows. I don't know if you can really see the extent of their skinniness in there, but they were not the type of cows that we typically see when we're driving down a country road. And actually, the picture on the bottom, there's a line kind of going through the middle of the picture that is right under the acacia tree. That's a line of cattle that was being driven. What they were doing is they were having to drive their cattle further and further and further away. Actually, when we were there, they were bringing them all the way to Tanzania, which was over a 25-kilometer hike, one way, so 50 kilometers round trip. But they were bringing their cattle to try to find a water source. So what we were doing there was trying to help this one community called Meshanani get water. They had tried to dig a few boreholes to use groundwater. One came up dry and one came up so salty the animals wouldn't drink it. So they were starting to look for surface sources. And so the school was where their kind of community center, the Meshanani Community Center, and that's where they wanted a tap to be. And so we were asked to investigate 2 different water sources and then to design a piping system from those 2 systems to the school. And those 2 systems were a shallow well and the spring, which I'll show you pictures of. The scale on this, the shallow well is 12 kilometers away and the spring was 14 kilometers away, not an insignificant distance. The reason that these 2 were selected is they were the closest water source that was not on Kenya Wildlife Services land. There was a water source that was closer, but the Meshanani did not have a good relationship with Kenya Wildlife Services. They often got pushed around by the Kenya Wildlife Services wardens. They would get arrested at times if they did something illegal. So they just really wanted to avoid using their land. So these were the 2 sources we were looking at. Both of them, have to cross over this large expanse, which is a seasonal lake. This is what the seasonal lake looked like while we were there and what it's looked like for the past several years because it's a drought. Why this is technically difficult is if it did ever become a lake again, then you have to deal with the shifting of the water table, which is going to make putting a pipe system through there technically more difficult. And that actually ended up raising our expected cost of the project to being over $100,000, money that these people did not have. This is the spring that we were looking at. It's not protected. You have zebras down there. We were there several times. There were always wild animals there. No elephants were there, but one of the things with natural springs is, again, elephants are very destructive and can destroy a spring and make it inaccessible to get water out of. And in the upper right-hand picture, you see us, we were trying to measure the flow, and it doesn't look like particularly clean or tasty water. This was the shallow well, again, completely unprotected. It's very easy for it to become contaminated source and also hard to develop as a source for drinking water. I just want to show a contrast. This is the Serena Lodge in Amboseli National Park, where it costs something like $800 a night to stay there. This is their spring in the upper left-hand corner, very protected. You also see very green because it's also protected from animals. In the upper right-hand picture is their version of an irrigation system. The fact that they had water for irrigation because of that spring. That spring was the spring that was supposed to be feeding the pipeline for the Meshanani community. We were there at several points over the time we were there at all hours of the day, and those sprinklers were going constantly. For the engineers in here, they're also non-native plants, which we know are not good for just an ecosystem. They also had this beautiful, clean, freshwater pool and their very plush dining room. So again, just to show you a little bit of contrast of what the Maasai were dealing with and what was just next door, where they were working, in fact. So how did this happen to Meshanani? They have very little political clout. The Kenyan government in general is very tribal, and the Maasai are the lowest on the totem pole. So they didn't really have a lot of voice to argue against some of the policies and promises that they had. Also, in 2007, Kenya had a lot of conflict and violence, actually, after the election. So that made them even more gun shy to really try to put up a fight with the Kenyan government. Water is Life Kenya is a nonprofit organization, an NGO, and they have actually made great strides speaking on behalf of the Maasai and the Meshanani to the Kenyan government. And in the past year, because the drought had gone to such a drastic state, they have started to make inroads with developing water systems. There has been the promise to reestablish the pipeline, and they're working on that, although Water's Life Kenya is providing a lot of that. So we saw a conflict between a community and the state. Within the community, though, they were very organized. So with a water source available to them, they would be able to manage it well. Thailand, on the other hand, we were working in a community where the NGO was working with an orphanage and then two other communities, Bobem Khao and Bobem Mai. And what we saw there, this is on the border of Myanmar. It's a very water lush area, so water was plentiful, but there wasn't really a good delivery system. We were putting in the delivery system, and these are just some pictures of the local community. There's a source, it's very protected. And as you came this pipeline down, what we saw was the Boban Mai community. They had cut into the line and were stealing the water from the rest of the orphanage and the other village. And we traced that pipeline, and it ended up being to a fish pond of the chief, essentially, of that village. So we built this tank here to be partially for storage, but partially also for distribution. And while we were there, we kept it so it seemed equal. However, we gave an engineering recommendation for how to alter the system so the one community that was sort of stealing the water wouldn't be able to steal it. So just wrapping up, what we can see is that when access is limited, public health can suffer and therefore the conflict can arise. And you need to either have a strong connection between community and state, or even a strong connection within the community for any sort of conflict resolution.
Thank you very much, Bridget. And now Mary Hennigan, who is from Catholic Relief Services, will respond to our speakers. Mary?
Thank you. It is a lot of wires down here. I'm really delighted to have this chance to respond. I think both presenters did a really good job of laying out some of the key public health issues and the political issues, the cultural issues that surround water and health. As mentioned before, my primary interest is child growth and development, and particularly looking at how do we prevent stunting in children under the age of 2. And I think the presenters did an excellent job of talking about malnutrition, especially where hand washing can reduce deaths in children. It's a very clear evidence-based. It's been proven to be as effective almost as food by making sure children aren't sick. Another area that I thought that came to mind was around exclusive breastfeeding. And that's a term that's probably not used here in the U.S., but it's an evidence-based understanding that children who are exclusively breastfed from the first moment of life until age 6 months are more likely to be well-nourished, healthy, and survive those first critical months. Exclusive means nothing by mouth, but here becomes the conflict. Often in cultures, babies who are crying, the mother is seen as a bad mother. And so she does give water to that child to try to quiet the child down. Often cultures feel that a baby will be thirsty because it's hot or dry or humid conditions. So bad water is introduced when, in effect, breast milk is the best and only food for a baby. And those babies who have been exclusively breastfed look like major elephants compared to the other ones in their communities, and they go on to healthier lives. The mother has a conflict, and the household has a conflict around the whole issue of that clean water, because the water is not just they pick up water from a well or from a stream, it's the cost of the firewood. And that's another major issue of how do you boil the water, how do you treat the water. All of that takes away not only money, but away from the mother's time. I really appreciate the whole issue that was mentioned on gender here, because water is a major gender issue for women. Women do walk 3 miles a day. And in the last trimester of pregnancy, that is a major, major factor in the health of that mother. And maternal deaths is a serious problem. A baby, a mother who doesn't get enough rest, doesn't get enough food, is likely to have a low birth weight baby. A low birth weight baby goes into malnutrition and stunting, and at age 2, it's irreversible. The other issue that I thought was really important to bring up is latrines and firewood. Latrines seem like it's a fairly easy thing to use or make. It is not. It's very conflicted. Often men don't want to use latrines where women or their daughter-in-laws have been in. Children are afraid of the latrines. I've often done barrier analysis, looking at the barriers to latrine use. One that we found was they didn't like the smell. Well, it turned out our engineer had made a mistake in the design of the latrine, so we reduced that barrier in a hurry. But there's all sorts of issues. The one that is really serious, that women are often raped going to latrines, or they're attacked. That's why often in camp situations or refugee situations, latrines have to be in very secure areas. Women have their separate latrines. Firewood also is another issue. It's not easy to collect firewood to boil your water. Firewood often is an area where women have to go miles and miles for firewood. They have to go miles and miles for water. And they are often, in the case of Sudan, in the Darfur area, raped in the process of gathering that firewood. So even though knowledge is very high often that people know they should have clean water, they know they should get rest during pregnancy, they know they should use a latrine, there's different barriers there that are very seriously affecting them, and they're used to it. One of the most interesting issues, I think, is the whole issue of the health systems. And we talked a little bit about the political system, and I thought it was very well done, where systems often don't like different cultures. But the health system has, if you trace it and you look at primary health care through the years, it started out maternal and child for all people. And then it went to maternal and child health, because they realized that if you can reduce maternal and child health problems, you could cover a lot of issues. Well, with HIV, with accidents, I'm glad you mentioned traffic accidents. It's a major problem in the developing world. Cardiovascular disease, obesity, diabetes, these are all playing into the issue of the health system. They cannot afford to deliver services to all these different issues. And it's often now the results that we have seen in child survival, children having better chances to live, are going backwards because the health system has to reach out and capture HIV, capture motorcycle accidents, things like that. So when you look at water, it sounds so easy, but it is so integral in part of the health services, people's cultures, their practices. It leads to a lot of conflict, not the blow up Darfur situation, but it leads to a lot of conflict in the family. And domestic violence is very underreported in the developing world. But a woman has to go out, get the water, go out, get the firewood, go out, do a lot of heavy labor in the fields. So these conflicts are often not talked about in the sense of a political conflict, but it's a domestic conflict. It's the views and the roles of women and men in raising children and providing for household help. That's very important. So I think both of you did a great, I loved the approaches here, and I really appreciated having this chance to share a little bit also with you. Thank you.
We have a few minutes for questions of our panelists, and if you would like to make a comment or question directed to one of the panelists or to Mary Hennigan, the floor is open. Yes, Lee.
Should I try to use this?
Well, you can shout or you can try to use it. I think it's on.
This is for Professor Watson. I was curious about the technical capacity. It's not large, but the technical capacity in your Maasai example. Was there really some local people there that could handle maybe disinfection and flow in the pipes, repair the pipes, etc.?
That's an excellent question. Actually, when we were there, because their primary occupation is cattle herding, they don't have a lot of technical capacity in terms of any sort of infrastructure, really. So that was a major hurdle in terms of who is going to maintain the system, who is even going to help build the system, not even from a chlorination or chemical type viewpoint, but even just like the physical plumbing of it. I know the system that they've been working on, they've had to actually hire out some professional plumbers, and they have been doing training of some of the townspeople. Again, it's not that they don't have the capacity, it's just that it's not part of the way they do it. I don't know if you saw in the picture, but actually their houses are mud huts, and the women built them, actually. But of course, a woman would not be allowed to be the, village engineer. No, so, or not for a while at least. So they're the ones who actually build the structures, and the men again are out with the cattle herding. So they're still working on trying to get technical capacity up.
Someone else? Yes, sir.
Could you say more about the tablets and their potential?
The question was, can she say more about the tablets and their potential?
Well,
The tablets.
you had on your list.
Possibilities with bleach and iodine. That's an expense issue. I mean, obviously, the SODIS issue actually with using bottles, empty soda bottles and so forth of a certain size and in the sunlight, that's actually the most cost effective for small amounts.